Now let's look at another clinical scenario. There is an 80-year-old female who is complaining of constipation and pain abdomen, and erect abdominal radiograph is attached. Which of the following is correct? So if you look at this particular X-ray is showing you a very classical appearance. What it is? It is a very largely dilated bowel loop which is gas filled, and what it is showing like? It is typically occurring like a coffee bean. So this is called as a coffee bean sign. And where do we find this coffee bean sign? Let's try to dissect. Now this is a classical case of sigmoid volvulus. Now how does sigmoid volvulus behave? Sigmoid volvulus. So how does sigmoid volvulus behave? Now there in a normal circumstance, this is the way the large gut lies. This is the rectum, sigmoid colon. These are the ascending and the descending colon and the transverse colon. But what will happen if the sigmoid colon form a knot around itself like this? So it will keep on enlarging because there is some form of obstruction here. Why there is obstruction? Because there is bending of the bowel loops. The bowel loops have been twisted over their axis. So this pathology is called as sigmoid volvulus. Now let us discuss the various type of radiographic signs that we can expect in sigmoid volvulus. So now let's dissect this image and try to find out what are the signs that we can see. This particular volvulus, where is its base lying? Its base lying in the left lower quadrant. And where can you see its apex? Its apex is lying in the right upper quadrant. So what lies in the right upper quadrant? Liver. What will this volvulus do once it keeps on enlarging? It will come over the surface of liver, and this type of sign is called as liver overlap sign. Similarly, the other structure adjoining the liver, what is there? It is the hepatic flexure of colon. So if it is going up ahead and it is going superior to the transverse colon, this type of sign is also called as northern exposure sign. So remember, these two signs represent nothing but the cranial extension, superior extension of the volvulus. Once it is going to go above the liver, it is going to be called as liver overlap sign. Once it is going to go over the transverse colon, it is called as northern exposure sign. Then the third sign, just look at it. Doesn't it look like an omega? So this is called as the omega sign. Apart from the coffee bean sign that we've talked about, there is another sign which is quite similar to coffee bean sign, that is omega sign. Now last but not the least, we can see that there are three lines which are seen converging at the level of the volvulus. So 3 rhymes with what? Free. So this type of sign is going to be Freeman-Dahl sign. So these are all the signs which are associated with sigmoid volvulus. One more thing, when we talked about sigmoid volvulus, we talked that sigmoid volvulus is just like the twisting of the large gut hair. So what type of obstruction it will cause? It will cause only a large gut obstruction, but not a small gut obstruction. There is large gut obstruction in this case. Will you find rectal gas here? Because the obstruction is occurring at the level of sigmoid colon, so rectal gas would be absent. So this is another sign that is quite easy to understand and quite easy to remember. So now coming on to the next type of volvulus. The other volvulus can be cecal volvulus. How does cecal volvulus occur? Again, as I told you that this is a normal large gut. Now what will happen if everything is normal but this cecum folds on itself? So one cecum will twist on itself. This type of appearance would be called as a cecal volvulus. So how will cecal volvulus behave? Cecal volvulus will cause obstruction at the level of IC junction. So there will be small bowel obstruction, and as you can see, where is its apex and its base going to be lying? Its apex is going to be just opposite to what we studied in sigmoid volvulus. It will be in the left upper quadrant, while the base would be in right lower quadrant. One of the other signs that is given with this particular volvulus is this volvulus looks just like an embryo. So it is also called as cecal embryo sign. One more thing I want you to have a look at, that cecum contains hastrations. So these hastrations would be well seen in cecum even if it is dilated. On the other hand, look at sigmoid colon. Can you look at any particular hastration in this? So sigmoid volvulus will not show any hastrations and it will be ahostral. So now let's quickly summarize the difference between two types of volvulus, sigmoid and cecal. So what are the differences going to be? Where is the base of the sigmoid volvulus going to be? It is going to be in the left lower quadrant, while the apex would be in the right upper quadrant. On the other hand, where is the base of the cecal volvulus going to be? It is going to be in the right lower quadrant and the apex in the left upper quadrant. Bowel obstruction will be a large bowel obstruction. With cecal volvulus, it is going to be a small bowel obstruction. How many loops were there which were involved in a sigmoid volvulus? There were 2 loops which were involved. On the other hand, cecum is just 1, so there's only 1 loop in cecal volvulus. The age is usually elderly patients, while this can be seen usually during pregnancy and can be seen even in young patients. The treatment is, in this case, we can undergo an endoscopic detorsion, but the treatment of cecal volvulus is usually surgical. So this is all what you need to remember about sigmoid and cecal volvulus. So let's come back to the clinical scenario with which we started our discussion. It is classical case of sigmoid volvulus. It is caused due to torsion of cecum. No. It shows obstructions. No. Northern exposure sign is noted. Definitely correct. It is caused due to rectal mass. No. So with this, we complete our discussion on sigmoid and cecal volvulus.